Try
Today
to.
we're gonna talk about multiple sclerosis. Multiple sclerosis is a potentially disabling disease of the brain and spinal cord. In MS, the immune system attacks the protective shield that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerves. Signs and symptoms of MS vary widely and depend on the amount of nerve damage and which nerves are affected. Some people with severe MS may lose the ability to walk independently or at all, while others may experience long periods of remission without any new symptoms. Unfortunately, there is no cure for multiple sclerosis. However, treatments can help speed recovery from attacks, modify the course of the disease, and manage symptoms. Multiple sclerosis signs and symptoms may differ greatly from person to person and over the course of the disease depending on the location of the affected nerve fibers. Symptoms often affect movement, such as numbness or weakness in one or more limbs that typically occurs in one side of your body at a time, or your legs and trunks. Electric shock sensations that occur with certain neck movements, especially bending the neck forward, tremor, lack of coordination, or unsteady gait. There are also vision problems, and they are also common, including partial or complete loss of vision, usually in one eye at a time, often while pain during eye movement, prolonged double vision, and blurred vision. Multiple sclerosis symptoms may also include slurred speech, fatigue, dizziness, tingling, or pain in parts of the body, problems with sexual, bowel, and bladder function. See your doctor if you experience any of the symptoms you listed for unknown reasons. Most people with MS have a relapsing remitting disease course. They experience periods of new symptoms or relapses that develop over days or weeks and usually improve partially or completely. These relapses are followed by quiet periods of disease remission that can last months or even years. Small increase in body temperature can temporarily worsen signs and symptoms of MS. At least 50% of those with relapsing remitting MS eventually develop a steady progression of symptoms. With or without periods of remission within 10 to 20 years from disease onset, this is known as secondary progressive MS. The worsening of symptoms usually includes problems with mobility and gait. The rate of disease progression varies greatly among people with secondary progressive MS. Some people with MS experience a gradual onset and steady progression of signs and symptoms without any relapses, known as primary progressive MS. The cause of multiple sclerosis is unknown. It's considered an autoimmune disease in which the body's immune system attacks its own tissues. In the case of MS, the immune system malfunction destroys the fatty substance that coats that protects nerve fibers in the brain and spinal cord. Myelin is an insulating layer or sheath that forms around nerves, including those in the brain and spinal cord. Myelin can be compared to the insulation coating on electrical wires. When the protective myelin is damaged and the nerve fiber is exposed, the messages that travel along the nerve fiber may be slowed or blocked. It isn't clear why MS develops in some people and not others. A combination of genetics and environmental factors appears to be responsible. These factors may increase your risk of developing multiple sclerosis. Age: MS can occur at any age, but onset usually occurs around 20 and 40 years of age. However, younger and older adults can be affected. Gender: women are more than 2 or 3 times as likely as men are to have relapsing remitting MS. Family history: self-explanatory. Certain infection: a variety of viruses have been linked to MS, including Epstein-Barr, the virus that causes infectious mononucleosis. Race: white people, particularly those of Northern European descent, are at higher risk of developing MS. People of Asian, African, or Native American descent have the lowest risk. Climate: MS is far more common in countries with temperate climates, including Canada, the northern United States, New Zealand, Southeastern Australia, and Europe. Vitamin D: Having low levels of vitamin D and low exposure to sunlight is actually associated with a greater risk of MS. Certain autoimmune diseases, you have a slightly higher risk of developing MS if you have other autoimmune disorders such as thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disease. Smoking. Smokers who experience an initial event of symptoms that may signal MS are more likely than non-smokers to develop a second event that confirms relapsing and remitting MS. People with mental illness may also develop muscle stiffness or spasms, paralysis, typically in the legs, problems with bladder, bowel, or sexual function, mental changes such as forgetfulness or mood swings, depression, and epilepsy. There are no specific tests for MS. Instead, a diagnosis of mental illness often relies on ruling out other conditions that might produce similar signs and symptoms, known as a differential diagnosis. The doctor is likely to start a thorough medical history and examination. Your doctor may then recommend blood tests to help rule out other disease with symptoms similar to MS. Tests to check for specific biomarkers associated with MS are currently under development and may also aid in diagnosing the disease. Spinal tap, in which a small sample of cerebrospinal fluid is removed from a spinal canal for laboratory analysis. This sample can show abnormalities in antibodies that are associated with MS. A spinal tap can also help rule out infections and other conditions with symptoms similar to MS. There's also MRI, which can reveal areas of MS on your brain and spinal cord. You may receive an intravenous injection of a contrast material to highlight lesions that indicate the disease is in an active phase. Evoked potential tests, which are called the electrical signal produced by your nervous system in response to stimuli. An evoked potential test may use visual stimuli or electrical stimuli. In these tests, you watch a moving visual pattern or short electrical impulses are applied to nerves in your legs or arms. Electrodes measure how quickly the information travels down your nerve pathways. In most people with relapsing remitting MS, the diagnosis is fairly straightforward and based on a pattern of symptoms consistent with the disease and confirmed by brain imaging scans, such as MRI. Diagnosing MS can be more difficult in people with unusual symptoms or progressive disease. As we talked about, there's no cure for multiple sclerosis, but treatments are available. Treatments typically focus on speeding recovery from attacks, slowing the progression of the disease, and managing MS symptoms. Some people have such mild symptoms that no treatment is necessary.
Yo. Okay. Treatment for MS attacks. The first thing um, that you can use is corticosteroids, and they are described to remove nerve inflammation. You know that inflammation comes with autoimmune diseases. Some side effects are insomnia, increased blood pressure, increased blood glucose levels, mood swings, and fluid retention. The second thing that you could do is plasma exchange. So what they do is they take some of your blood and they mix the blood with um, a protein solution, albumin, and they put it back into your body. This may be used if the symptoms are new, severe, and haven't responded to steroids. Um, yeah, next slide. Okay, there's as Rayan was talking, there's two main types. There's primary progressive MS, multiple sclerosis, and that this is when it's not like in relapsing remitting. It's just that's like episodes. Progressive is progressive. It gets worse as time goes. The main treatment for it is ocrelizumab, and it's the only FDA approved disease modifying therapy. Um, so this is one of the only treatments available for this. Those who receive this treatment are less likely to progress than those who are untreated. And then for the autoimmune other type, relapsing remitting MS, there are several disease-modifying therapies that are available and that you could use. Much of the immune response associated with MS occurs in the early stages of the disease. Much of the immune response associated with MS occurs in the early stages of the disease. Aggressive treatment with this medication as early as possible can lower the relapse rate. So the formation of lesions and potentially reduced risk of brain trophy and disability. Next slide. Many you can modify progression of the disease. Many of the disease modifying therapies used to treat MS carry significant health risks, mainly because you're dealing with the nervous system and it's pretty sensitive. Selecting the right therapy for you will depend on careful considerations of many factors, including duration, severity of disease, effectiveness of previous MS treatments, other health issues, costs, childbearing status. So it's serious treatment. It's a serious disease. Deals with your brain. So it's going to be costful. It's going to have great risks. You're going to look at other health issues. You have to put all of these things in mind. And so because before treatment, because it is a heavy load, let's say. Treatment options for relapsing remitting MS include injectable and oral medications. Next slide. There are some treatments that you could take for controlling the signs and symptoms, not the disease itself. One thing is physical therapy. A physical or occupational therapist can teach you stretching and strengthening exercises and show you how to use devices to make it easier to perform daily tasks. As we know, there's a disruption between the connection between the brain and the muscles. Physical therapy, along with the use of mobility aid when necessary, can also manage leg weakness and other gait problems often associated with MS. Another thing that could be used is muscle relaxants, and it's just to deal with the pain and uncontrollable muscle stiffness, just so your muscles don't feel any pain, basically. And it's usually in the legs. Next slide. Medication to reduce fatigue. Well, given the immune system, there you always have fatigue, so there are some basic drugs that can be used to reduce fatigue. Medication to increase walking speed, and may help slightly increase walking speed in some people. People with a history of seizures or kidney dysfunction should not take this medication. Other medications, there are other medications to deal with other side effects such as depression, such as pain, such as insomnia. Yeah, next slide. Oh no, 5 minutes left. Okay. Lifestyle and home remedies to help relieve the signs and symptoms. Get plenty of rest. Look at your sleep habits to make sure that you're getting the best possible sleep. To make sure you're getting enough sleep, you may need to be evaluated and possibly treated for sleep disorders such as obstructive sleep apnea. So sleep, if I'm not mistaken, it's really important for like the brain and the electric, whatever they call it. And it's important to also do exercise. If you have mild to moderate MS, regular exercise can improve your strength, muscle tone, balance, and coordination. Swimming or other water exercise are a good option if you're bothered by heat. Other types of mild, moderate exercise recommended for people are walking, stretching, low impact aerobics, stationary bicycling, yoga, and Tai Chi. Oh, old man workout. Next slide. Other things is cool down. Symptoms worsen when body temperature rises, so avoiding heat and cooling off is important. Eating a balanced diet. Since there's little evidence to support a particular diet, experts recommend generally healthy diets. Some researchers suggest vitamin D may have potential benefits for people with MS. Relieve stress. Stress can trigger and worsen your signs and symptoms, especially because it's autoimmune disease in the brain. yoga, tai chi, massage, meditation, and deep breathing can help in relieving stress. Next slide. Alternative medicine. Many people with MS use a variety of alternative and complementary treatments or both to help manage their symptoms, such as fatigue and muscle pain. Um, Activities such as exercise, meditation, yoga, massage, eating a healthy diet, relaxation techniques may boost overall mental health and physical well-being. The research strongly indicates that oral cannabis extract may improve symptoms of muscle spasticity and pain. Daily intake of vitamin D3 could be really important. The connection between vitamin D and MS is supported by the association with exposure to sunlight and the risk of MS. So if you could get some sunlight and get some vitamin D, that would be good. Otherwise, take supplements. Next slide. Coping in sport, basically just make sure you're mentally well. Living with a chronic illness is difficult. To manage the stress of living with MS, just maintain normal daily activities, stay connected to friends and family, continue to pursue hobbies, contact a support group, discuss your feelings and concerns with your doctor or counselor. I think that's it. Next
Yeah,
slide.
there's the end of
Right.
the presentation. Thanks for your attention.